Endometriosis is a chronic, often painful condition where tissue similar to the endometrium, the lining inside the uterus, grows outside the uterine cavity. This tissue can be found on the ovaries, fallopian tubes, the outer surface of the uterus, and other organs within the pelvis. Advances in the diagnosis and management of endometriosis have significantly improved outcomes for those affected by this condition. Here's a detailed look at the recent progress. Advances in diagnosis. Non-invasive biomarkers. Research is ongoing to identify specific biomarkers in blood, urine, and menstrual fluid that can aid in the early and non-invasive diagnosis of endometriosis. Examples include CA-125, interleukins, and microRNAs, although none are yet definitive. Imaging techniques. Transvaginal Ultrasound, TVUS. Enhanced techniques have improved the sensitivity and specificity of TVUS for diagnosing ovarian endometriomas and deep infiltrating endometriosis, DI. Magnetic resonance imaging, MRI. MRI is highly effective in visualizing deep infiltrating endometriosis, particularly in the posterior compartment, e.g., rectovaginal septum, uterosacral ligaments. Laparoscopy. Laparoscopy remains the gold standard for diagnosing endometriosis. However, advances in imaging and less invasive diagnostic methods aim to reduce the need for diagnostic laparoscopy. Laparoscopic techniques have also improved, with better visualization tools and dye techniques to identify smaller lesions. Molecular imaging. Techniques like positron emission tomography, PET, and single photon emission computed tomography, SPECT, are being explored for their potential in detecting endometriotic lesions based on metabolic activity. Advances in management. Medical therapies. Hormonal treatments. Continuous oral contraceptives, GnRH, gonadotropin-releasing hormone, agonists and antagonists, and progestins are commonly used to manage symptoms. New medications. Elagolix, an oral GnRH antagonist that provides effective pain relief with fewer side effects than traditional GnRH agonists. Selective progesterone receptor modulators, SPRMs, agents like ulipristal acetate are being studied for their efficacy in treating endometriosis. Aromatase inhibitors. These reduce estrogen production and are used in refractory cases. Surgical management. Minimally invasive surgery. Advances in laparoscopic and robotic-assisted surgeries have improved precision, reducing recovery times and complications. Excision versus ablation. Excision of endometriotic lesions is preferred over ablation, as it provides better symptom relief and lower recurrence rates. Nerve-sparing techniques. These aim to reduce pelvic nerve damage and preserve fertility and function. Pain management. Multimodal pain management, combining pharmacologic, analgesics, anti-inflammatory drugs, and non-pharmacologic approaches. Physical therapy, acupuncture. Neuromodulation. Techniques like transcutaneous electrical nerve stimulation, TENS, and spinal cord stimulation are being explored for chronic pain management. Fertility preservation. Assisted reproductive technologies, ART, IVF, in vitro fertilization, and ICSI, intracytoplasmic sperm injection, are common for women with endometriosis-related infertility. Ovarian reserve preservation. Strategies to preserve ovarian function during surgery include careful surgical techniques and medical suppression of ovarian activity. Lifestyle and supportive therapies. Diet and nutrition. Anti-inflammatory diets and specific supplements, e.g., omega-3 fatty acids, are being researched for symptom management. Psychological support. Cognitive behavioral therapy, CBT, mindfulness, and support groups play crucial roles in managing chronic pain and the emotional impact of endometriosis. Future directions. Personalized medicine. Developing individualized treatment plans based on genetic, epigenetic, and molecular profiles of patients to improve outcomes and reduce side effects. Gene and stem cell therapies. Research is investigating the potential for gene editing and stem cell therapies to treat or even cure endometriosis in the future. Long-term disease modulation. Exploring drugs that could modulate disease progression rather than just symptoms, aiming for long-term remission. Public awareness and education. Increasing awareness and education about endometriosis to promote early diagnosis and reduce the stigma associated with the disease. In summary, while significant strides have been made in the diagnosis and management of endometriosis, ongoing research and innovation continue to pave the way for more effective and personalized treatments. Thanks for watching this video.